Our question is, how might we increase the sense of safety for school reopening? The users we are designing for include school nurse Sally, who before COVID-19 had a ratio of one school nurse to several hundred or thousand students. She had death by paperwork and is in an information silo. We have petered out parents who are totally at capacity and need students to go back to school so they can go to work. We have students that probably want to go back to school more than they thought they would, but could be scared and worried about getting sick. We also have sideline nursing students who, because of their campuses and clinical sites closing, are unable to complete their required clinical hours. Yesterday, the CDC released these guidelines for students to safely go back to school. If you think that this looks like a lot of steps for a single school nurse to handle, then you'll agree with us that this looks good on paper. Our problem is that the National School Nurse Association reported last month that they're going to need an additional 10,000 school nurses in order to safely reopen the schools. We have a population of nursing students willing to help but lacking mobilization. Parents are fried, and tech alone is not going to be the remedy. We think we can solve everyone's needs by leveraging people and tech together. Our people solution is the School Nurse Corps. School nurses will be matched with nursing students on a multi-sided platform who can be deployed and help in a contactless virtual capacity. They'll be able to reinforce school nurses by helping to triage and analyze data prior to school start times, which coincidentally will help transform nursing education so students can learn more about informatics and community health, which are typically underrepresented in nursing school curriculum. School nurses will be able to multiply their power and reach by becoming an entire nurse screening team. And school nurses will be able to follow up on anyone that has missing data. And for anyone that's out of school, they can connect with contact tracers, emergency rooms, or pediatricians. Our tech solution will also include mobile screening for the students and teachers. And that data will be connected to RFID bracelets so that school staff like bus drivers can scan the students and know who's cleared and safe to get on the bus or enter the school buildings. RFID is affordable and safe, and this helps free up the school nurses to be on site and focus on all of the other issues like the asthma and the insulin and the ADHD management. We will also make sure to prepare parents, teachers, and students by giving them a care package prior to school reopening that will help to reduce ambiguity and anxiety and reinforce trust and partnership between school and families. This is a sustainable initiative because we will be able to pilot it as early as the fall, and we can demonstrate a positive impact on reduction of missed school days, teacher absences, and community-acquired infections. It's scalable because there are over 300,000 nursing students enrolled in the USA. We have a business model that will be a nonprofit consortium, and those that are gaining the most in the current economy will help to give back to schools so their employees will be able to confidently go back to work knowing that their students and children are safe. Our nation is unified that we need schools to operate safely so students can achieve their greatest potential and parents can get back to work. Can we count on your support?